Hi, today I'm going to give you an update on Swedish model against COVID-19. And just in case you don't know what is Swedish model against COVID-19, here I just give you a very brief introduction. And the Swedish model basically is a relaxed model, and that they don't have lockdown. The lives more or less normal. And we follow up this model in the beginning of this pandemic, and we follow this and because this is a good model for us to compare lockdown and no lockdown between these different countries. This good model to compare with. And so Swedish compared to the neighbor country like Denmark, Norway and Finland. So we see how effective this Swedish model. And today is December 4th, 2020. So, and we did this little bit early because we would like to see some data. And that's because this holiday season is closing. We would like to give some good advice to people and to see how effective is the Swedish model. As of today, December 4, 2020, and we have here we have data the total cases and the total deaths among these 4 Nordic countries. Apparent that Sweden have the highest total case and very high total deaths, but this is low data, so it cannot be compared. So we transfer this data to 1 million population and the total case, and the 1 million population total deaths. You can see that in Sweden, the 1 million population total cases close to 27,000, and this number is almost 2 times of Denmark, and 4 times of Norway, and 5 to 6 times of Finland. And when we look at this total deaths in 1 million population, this number even higher. This is a difference. You can see this close to 5 times difference between Sweden and Denmark, and this close to 10 times difference between Sweden with Norway or Finland. And this is really set data to show this that indicate the Swedish model is not working, because this is the most important epidemiology data. So you have close to 10 times that in 1 million population, and so there are a lot of life lost because you practice such relaxed policy. And some people argue that Sweden should compare to Spain or Italy, and they actually have a similar number. But geographically and population based, Sweden is completely different from Italy and Spain. So I think it's more fair to compare Sweden with Denmark, Norway and Finland, and because that give you more comparable data. But if you compare to a land far away, and the population geographic is completely different, so it's hard to get a conclusive information. But this here, I think data is much more comparable. And also going to see this dynamic process. As I mentioned, that we start in the very early stage. We follow the Swedish model, and we did some data on April, July, October, and now we did this one December, a little bit early, a little bit less than 3 months. And you can see in the early stage, and actually the 1 million population actually no huge difference. And also the death is there's some difference, but it's not huge difference. So as the time going, we know that during July and October, and looks like it reached plateau, and both in the total cases in 1 million population and the total deaths in 1 million population in terms of Sweden, and this stabilized become from 7,000 to 9,000, and total deaths 500 to 580. And other countries also kind of stabilize between these two numbers, total cases, total death. Of course, but this huge difference between Sweden and other Nordic countries. And we can see during this time, the cases almost stabilized. But in December, and the cases start to jump, and this is almost 3 times compared to October. And same is true for other Nordic countries. But what we need to focus on here is total deaths in 1 million population, and reach close to 700 in Sweden, and Denmark is 148, and this is close to 5 times difference. And when you compare to Norway and Finland, you can see this 10 times difference, and that is a huge number too. And as I mentioned, if they practice some restrictive policy, and this number should be, the number in Sweden should be like in other Nordic countries, so they have a lot of life was lost because this policy. It's very clear data. I don't think from all time we follow that it's clear that the policy is not correct. And the question is now that we enter into this holiday season, and as expected, because cold winter is coming, these people is more have indoor activity, and this second wave, it's very clear that the second wave is coming. And here just give some example in Sweden, Norway, and as happening in all European countries and in other countries in the North America, and they have second waves. And you can see that here Sweden is much higher. That is close 7,500, but in Norway there's 500. So this is a huge difference. And I think that right now it's still for Sweden still have time to practice restrictive policy to try to prevent the spread of this and the virus among the population. But I think if you take measure to control, still possible to have some effective ways to reduce cases and reduce deaths. Which even so, the government of course is to just give suggestion, but don't practice and don't force anyone to do anything. But for individual citizen, I think it's still good to practice strict policy to try to prevent you from catch this virus. I sincerely wish everyone have good health and happy life. I wish to see you in my next video. Bye.